20-year-old boy coming out of the classroom become unconscious all of a sudden. Since cardiac arrest can happen to anybody, anytime, anywhere, let's know about the principle of adult basic life support. In this video, we will cover the basics of CPR, including how to assess a situation, perform chest compressions, give rescue breaths, and use an automated external defibrillator or AED. By the end of this training, you will feel confident and empowered to act in an emergency.
For the basic adult life support is simple as the following steps: environment, initial assessment, activation, start CPR, defibrillation. For environment, make sure there is no explosion, electric lead, blood, and the patient is not too crowded. If the environment is not good, shift the patient to the safest environment. For initial assessment, response checking, breath checking, and pulse checking. For response checking, tap on each shoulder, speak to each ear. Hello, mister, can you hear me? Hello, mister, can you hear me? And make sure to check eye movement, limb movement, and any sounds coming from the mouth. If there is neither of them is absent, that means the patient is unconscious. For the breath checking, first see the chest movement and then bend over so that you can hear both. Breath checking, first see the chest movement and bend over so that we can hear both breath sounds. Next is the pulse checking. If the patient is male, see the Adam's apple and slide the fingers into the groove. If the patient is female, check the thyroid. If the patient is female, check the thyroid cartilage and slide the fingers into the groove and feel the carotid pulse for less than 10 seconds. The next is the activation. For activation, hello, can anyone come and call the ambulance?
Hello, 120 is an emergency call. I'm from China Medical School, Sichuan University, Washi campus, 8th teaching building. One of my friend suddenly fell down and he is unconscious. We are giving CPR, so come fast.
Pinch the nose, create an airtight mouth-to-mouth seal. Each rescue breath should be over the 1 second. Tidal volume should produce a visible chest rise. After each breath, release the nose and mouth. Okay? Compression is to breathing is 30:2. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30.
One, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30.
Rescuers rotate every 2 minutes, 5 cycles of 30:2. Use defibrillation as soon as it is available. Step is defibrillation.
For defibrillation, we will use an AED, automated electric defibrillator. How to use AED? First, we should press the green button, then attach the pads to the chest. One on the right side of the chest and another on the apex of the heart. Then we will put the plug into AED. Then the AED will give shock if defibrillation needed. For caution, everybody should hear. Then I will press the shock button. After defibrillation, we should give CPR immediately and we should recheck the pulse and rhythm every 2 minutes.
If you are confident that you have detected the signs of circulation, continue rescue breathing until the victim starts breathing on his own. Give rescue breathing 10 per minute. Reassess the pulse less than 10 seconds every 2 minutes. If the victim starts to breathe normally on his own but remains unconscious, turn into the recovery position. Be ready to turn him on his back and restart rescue breathing if he stops breathing. If you are confident that you have detected the signs of circulation, continue rescue breathing until the victim starts breathing on his own. Give rescue breathing 10 per minute. Reassess the pulse less than 10 seconds every 2 minutes. If the victim starts to breathe normally on his own but remains unconscious, turn into the recovery position. Be ready to turn him on his back and restart rescue breathing if he stops breathing. Recovery position. Hold the arm near to knee. Press the elbow, right angles to the patient body with the palm up. Step 2. Grab the far arm, place it across the chest to keep it pressed against the cheek. Step number 3. Hold the far leg with the knees up and the foot down. Step number 4. With the hand pressed against the cheek, pull the leg to roll the patient towards knee in one direction. Make sure to keep the hip and the knee at right angles. Keep the hand pressed against the cheek. Open the airway.
The American Heart Association has recently changed the order of the CPR from ABC to CAB in 2010. CAB, compression airway breath. It is the basic life support to save the people if he or she has the cardiac arrest, the sudden cardiac arrest, by saving the pumping the heart from the external to avoiding the damage of the external organs, lack of a blood supply. By checking the pulse, for example, we have to start the patient by checking the pulse, and we have to start doing a compression of the 30 into 2 breath. 30 press, the 30 compression and the 2 breaths of giving an oxygen in the ratio, the cycle of the 5:30:2. The 5 cycles 30 times and 2 breaths. It's like it's in the ratio. It's helping the defibrillation with the life support by calling the emergency of 120 or 119.